Okay, it's Labor Day, but have something left over from last Thursday. Last Thursday we did the lower appendicular skeleton, and I neglected to push the record button when I went over the bones with you at the very end. So I'm going to make that recording now, and it takes a while, a few hours, for them to process it, whatever that means, and get it back to me, and then I can post it for you. Okay, so this is for the lower appendicular skeleton. If you're trying to follow along with your sheets, um, we'll start with this bone. Hang on a second. There, that's a little awkward, but if I sit higher and have armrests here, I can hold things steadier for you. Okay, so that's the reason for the gymnastics there. Okay, this sometimes it's called the coxal bone. That one would not be the correct answer for anything that we do. Okay, it's a combination of three bones. At the top, you're seeing it right here. This is the ilium. Back here where I'm holding it now, where you would sit, is the ischium. And where I'm holding it now in the front is the pubis or pubic bone. Okay. We'll name the parts that are on your sheet for each of these structures. For the ilium, the easiest one to start with is the iliac crest, which goes from here over to here. Okay. Looking for my little pointer. I guess I just use my hand. The iliac crest. You're looking at it from posterior view here. Okay, lateral view would be to see here where the leg goes in. Okay, this is the posterior view. Turn it around to anterior view. And where the number 21 is located here, this nice smooth depression. That's called the iliac fossa. The iliac fossa doesn't articulate with anything. It rubs up against your internal organs. Putting your finger at the top of the iliac crest and moving moving anteriorly. Let's see if I can get this oriented right for you. Okay, it's over here. To move to this point right there. That point, you'll notice, is above this large indentation. That means we're going laterally. This is the anterior superior iliac spine. Hell of a name, but they're really not as hard to remember as you're probably thinking right now. Anterior superior iliac spine. Drop down about 2 inches to this point here, and we have the anterior inferior iliac spine. Two knobs. Well, we'll have two more on the other side of the body. And if you've ever been to the beach and seen somebody walking along, something skimpy, and if they're thin enough, they'll have those two knobs on either side. Some people say that's what you hook your belt onto, not if you're wearing a bathing suit. But those are the anterior iliac spines. Anterior superior, anterior inferior iliac spine. You're looking at this in anatomical view right now. Go back to the iliac crest, and I'm going to go in the other direction until I hit here. Do two at once, and here. The upper of these two spines, this is the posterior superior iliac spine. This is the posterior inferior iliac spine. You have 4 iliac spines on each side. These are the posterior iliac spines. And this is the anterior pair. Okay. This area in here that looks rather ear-like is really close to the midline. This is the auricular surface. We had an auricular surface the other day. We found it on the sacrum. And when you join the 2 auricular surfaces together into a joint, you have the sacroiliac joint. Proceeding from the posterior inferior iliac spine. Okay. Should be like this. We go under it. There's a large notch. Can't miss it. This large notch is the greater sciatic notch. Sciatic nerve and muscles and blood move through there into the leg. The greater sciatic notch really does look like somebody took a bite out of this bone. The greater sciatic notch going inferiorly terminates at this point. This is the ischial spine. Ischial spine doesn't have a lot of functional importance, but it does have a lot of importance in childbirth. If the ischial spines are too big on the 2 sides, it may be very difficult, if not impossible, to fit the newborn's skull through, in which case then a C-section might be considered. Go back to the ischial spine, and above it was the greater sciatic notch, and below it is a smaller indentation where I've got my finger right now. Now I don't. This is the lesser sciatic notch. Greater sciatic notch, and then the lesser sciatic notch, right here. Below that, and again, to put it in anatomical view, it would be like this. Okay. But I want to see this thing on the posterior side, right here. This structure. Well, greater sciatic notch, ischial spine, lesser sciatic notch, and now this large protuberance. This is the ischial tuberosity. When you sit on bleachers or chairs or anything hard for a long period of time, and you get up and you hurt, bones in the back, in your back hurt there. That's the ischial tuberosity that you have put pressure on for a while. If you go horseback riding and get saddle sores, that's the main site where the pain is coming from. Okay? If you ride a bicycle with a thin seat and you haven't ridden bicycles in quite some time, this ischial tuberosity is going to be responsible for your discomfort. Now I'm turning it laterally, the bone. Okay, the ischial tuberosity is back here. And we come along. Here's the ischium itself, this bone. The ischium terminates about halfway up into this cavity. The ilium terminates almost halfway down. And this bone in the front, the pubic bone, also enters into the cavity where all 3 come together. Remember, 3 bones in this one that we call politely the coxal bone. But the correct names are ilium, ischium, and pubis, or pubic bone. Okay. The hollow is to receive the head of the femur, of course. And the hollow portion is called the acetabulum. Acetabulum. Immediately below it, the largest opening. This is the obturator foramen. Nerves, the obturator nerve, which we'll learn about later, and muscles and blood all proceed through there. Obturator foramen. I always think of the word operator, and then I turn that P over and get the correct answer. Okay. In the front, the bone that I'm holding is the pubic bone. It extends up to here, where at the top it's called the pubic crest. The pubic crest is an alignment between this part of the pubic bone and the pubic bone on the other side, because of course we're going to have two of these coccygeal bones come together. This area in the very front, now I'll put it back into anatomical position. This area here, not getting good picture. This area in the very front will articulate or join with its partner on the other bone to make the pubic symphysis or the symphysis pubis. This bone admittedly has a lot of parts and takes going over a few times, but it's not all that difficult, especially if you get a system where you start one place, move on, move over, and go down the other side. I think you'll be able to get it. On Tuesday, since we don't have new lab material during the lab period, I'll be available to grab the bone box and show you anything that you want individually or as a group. Okay, that'll be after the lecture. Okay, so this is the first one. This is the, I hesitate to say coxal bone, but this is the ilium, ischium, and pubis bone. Okay. I find that if I grab the obturator foramen with two fingers, put my thumb across the top, like that, my hand is now completely covering the pubic bone. The ischium is back here. And of course, the ilium is way up here. But now you can't see the pubic bone because of the way I'm gripping it. So that's where the pubic bone is. I put my thumb across the top because that's the pubic crest. Okay. The next bone. Okay, now I swear to you, it will get easier. This is the femur. This is the largest, heaviest bone in the body. Here's the head of the femur. You may think, so what? They'll never ask that. It's too easy. We always ask it. Okay, so easy or hard, we have a combination of questions. Here's the head of the femur. The anatomical neck goes around here. Goes at an angle because his head is tilted. That's the anatomical neck, and this is also considered part of the neck, where I can squeeze it. Okay. In the head of the femur, you rotate it, you'll see a small crater. Okay, it does look like sort of a crater on the moon. That's the fovea capitis. Fovea capitis. It does allow for extra synovial fluid because it allows for extra room for synovial pouch. And of course, this is one of the most widely moved joints in the body. Now, we're going to put this in anatomical view. Is it this way or is it this way? Makes all the difference in the world as to whether this is a right or a left. Okay, first off, I'm going to not worry about the top. I'm going to go to the bottom. And at the bottom, this side is smooth. I'll tell you now, that's going to be the patellar ligament. Your kneecap will fit up against that. On the opposite side, there's an indentation. That indentation is the intercondylar fossa. That's on the posterior side of this bone. So we don't want to look at the posterior side to have anatomical position. We turn it around, and now we have anatomical position when we bring it back down. And I think you would imagine then that if this were on me, the bone would go this way. Okay? I'm not showing you my legs, but it would go in this direction here, and it would be on my right side. This is a right bone. This is a right bone. Okay. Going from the head straight across, there's a large protuberance again. This is the greater trochanter. One of the questions in the practice quiz that we just had. Trochanter is larger than a tuberosity, and that in turn is larger than a tubercle. This is the greater trochanter, the site of attachment of very important leg muscles. If you look under it to here, this is the lesser trochanter. The greater and lesser trochanters are responsible for being able to flex your thigh or flex your upper leg. And if we look on the posterior side for a second, you'll see that they're joined by what looks like sort of a moon-shaped isthmus. This is the intertrochanteric crest. Yes, it's on your study guide. Sorry, probably the longest word, but not hard. Intertrochanteric crest. You're still seeing the posterior side. I'm moving down the diaphysis or shaft, and on the posterior, you can see a ridge. Okay, that ridge is the linea aspera. The linea aspera is the site of extensive muscle attachments, especially for the semimembranosus muscle, so the muscles on the back of the leg, the so-called hamstring muscles. Linea aspera. Let's go back to anatomical view. You're now looking at it that way. I'm holding it by the shaft or diaphysis, and I want to get to the bottom here. Which is lateral, which is the medial side? Go back. This must be the medial side, attaches to the body. Okay, this is the lateral side. Whether we have anatomical view or posterior view, it makes no difference. The head is going to be medial. So let's come down now on the head side to this large protuberance here. I'm holding it by it right now. That's the medial condyle. Medial condyle. And on the other side is the lateral condyle. These articulate with the tibia with items of similar name to make the synovial joint that is part of the knee. Medial condyle is on the head side, so it's over here. Lateral condyle here. Now, somebody asked me a question today about the difference between condyles and epicondyles. The condyle is this large structure, but the little point on it, sorry about that, is an epicondyle. In the arm, when we did lateral and medial epicondyles, those were pretty distinct on our own arm on either side. The condyles were not. In the leg, it's the condyle that is large. And so we refer to that. Could have had you learn condyles and epicondyles both places. Maybe that would actually be less confusing. But we will only ask the condyles in the leg, and we will only ask the epicondyle in the arm. Between the medial and lateral epicondyles is that flat surface again, the patellar surface that the kneecap fits in. And then turning it around to posterior view is this large fossa, the intercondylar, between the condyles, the intercondylar fossa. Now, if you look, when I rotate this, you'll see that the condyles are quite large. Okay. The femur sits primarily on the tibia. This is the tibia. This is an anatomical view. Okay. I know it's anatomical view because it's got this bump on the front. Okay. We'll also want to know which is lateral and which is medial, but we'll get to that in just a second. First, in this upright view of the tibia, there are two peaks at the top. Those are called the intercondylar eminence or crown, intercondylar eminence. This is a condyle. This is a condyle. One is the lateral condyle and one is the medial condyle, but there's no way to tell just looking at this. We got to know which is the lateral and medial side of the bone. So to find out which is lateral and medial, we look at the distal end of the bone. And you see this like finger coming off. That's the medial side. This is the medial malleolus. The medial malleolus is the inside portion of your ankle. Okay. Inside portion of your ankle. You've probably scuffed it a couple of times. I've seen people going bowling and ran the bowling ball across to their other leg and hit this medial epicondyle, medial malleolus, I'm sorry. Malleolus, by the way, doesn't sort of look like the way it should be pronounced, but it is correct, malleolus. Here's the medial malleolus. Let's follow the medial side back up again. I'm still on to this structure. We know it's a condyle. We now know it's the medial condyle. This is the lateral condyle. Come to the intercondylar eminence. Come down the front about an inch, inch and a half, and you can see that knob there. That's the tibial tuberosity. You have a lot of connective tissue associated with that, but you also have the kneecap being anchored to it by the patellar ligament. If there's a lot of connective tissue associated with the tibial tuberosity, it can make it look like your area below your knees are swollen. Going down to the bottom again, here's the medial malleolus. So where's the lateral side? It's going to be over here. And there's a little notch in there. That notch is for the fibula. The fibula. I move this around to see if I get a good shadow, but it's pretty good. There it is. That's the fibular notch. And so the only thing missing here is the fibula itself. The fibula is going to fit on the lateral side of the bone, all the way down on the lateral side. So here's the medial side, here's the lateral side, and the fibula will go up to here. Now I'm going to try to hold a fibula in place, and you're not going to have to do this, fortunately. Give me a second to get a hold on this. This is like trying to hold chopsticks. Okay, at the bottom, the medium malleolus was over here. Now, the bottom portion, or the inferior part of the fibula, this bone, is making up the lateral malleolus. The lateral malleolus is your outer ankle. So there's your ankle, both sides. Lateral malleolus. The top of the fibula fits underneath here. So this fibula is not a matched set. It's a little too big. It fits right in here. And this is the head of the fibula. The head of the fibula tends to be more chunky, more cube shaped. You have to use some imagination to make a cube out of this, but you have to. Whereas the other side, the lower inferior part, is more snake-like in appearance. See the snake's head? The snake head end of the fibula, okay, is the lateral malleolus. The other end is the head. Okay. If you have trouble with that one, then you could easily just ask me to grab it out of the box and show it to you again on Tuesday. We got a lot of time on Tuesday. Okay. Now the last thing that we have to do for the lower appendicular skeleton is the foot. Okay, here we go. If I dangle it in front of you, this is the way the foot would essentially be. I'm holding it by the largest bone. That largest bone is the calcaneus, or the heel. You can't call it the heel. You have to call it the calcaneus. Let's get a lot of bones out of the way. The phalanges number 14 in each foot, just like they do in the hand. In the first digit, the largest digit, or big toe, which is this one over here, there are only 2 phalanges. This is the distal phalanx, and this is the proximal phalanx. After that, the next one, and the rest have 3. There's 3 bones showing here. I'm holding the distal phalanx. The middle is right under it, and under that is the proximal phalanx. That's the same for the 3rd, 4th, and 5th toes. The phalanges as a whole attach to 5 metacarpals that I'll let you see now. The largest metacarpal, this one here, is metacarpal 1 because it goes to the big toe, which is digit 1. So metacarpal 1, you can only guess that we then have metacarpal 2, 3, 4, and 5. So there's no trick to it. Just start with the largest one for the big toe. That's metacarpal 1, 2, 3, 4, and metacarpal 5. 5. Now, we're going to start with metacarpal 1, that's this one, and come back towards the foot. Let me get the best orientation for you. Metacarpal 1 touches one bone right down here. I'm going to make this work. Okay, there's metacarpal 1 up here, and this bone down here is cuneiform 1. Couldn't be easier. Metacarpal 2 attaches to cuneiform number 2, which is right here. Metacarpal 3 attaches to or articulates with cuneiform 3. My hand has pretty well, the other hand, has pretty well covered up the metatarsals. If I said metacarpal anywhere in that, I meant metatarsal, of course. The first three metatarsals I've got a hold of, but the first 3 bones they articulate with, are the first, second, and third cuneiform, usually called cuneiform 1, 2, and 3. Now your book may offer to you that they can also be called something else. This can also be called not just cuneiform 1, it can be the medial cuneiform because it's most medial when you're standing upright. The second one can also be called intermediate cuneiform, and then the third one can be called the lateral cuneiform. I don't like that. If you call it lateral cuneiform, it indicates to some people that it should be the most lateral bone, and it's not, because there's another bone over here, the cuboid bone. So I really, really, really suggest to you, for our purposes anyway, that you learn them as cuneiform 1, cuneiform 2, cuneiform 3, and then the cuboid, which articulates with metacarpals 4 and 5. You remember in the hand of I said carpals again, I'm sorry. Metatarsals 4 and 5 articulate with the cuboid. In the hand, when we did that, we found that the 4th and 5th digits also articulated with a single bone in the wrist. That bone was the hamate. Okay. Underneath the 3 cuneiforms, there's another bone that straddles all 3 of them. This is the navicular. The navicular bone. And then coming back from that, this bone is the talus. I used to pronounce it talus too, but it's talus. I lost that argument. Now, let's put this orientation here. There's the talus. This is the bone that articulates with the fibula and tibia above it. It's the only bone of the foot that articulates with the rest of the leg. This is the talus. It sits on top of that one we did first, the calcaneus, or heel. Forward of the calcaneus, if we follow it, we run right into the cuboid bone again. Here's the cuboid. Okay, now I seem to have it in a pretty good position for a moment here. So take advantage of it, okay? Let's do it. Metatarsal 1, 2, 3, 4, 5. Cuneiform 1, 2, 3. Cuboid bone and navicular bone. Talus coming down to the navicular. And then underneath, the one we don't need to see that much anyway because it's just so large, the calcaneus. Okay, good luck in studying this weekend or the rest of the day, if that's what you're doing. I'll get this posted as soon as they finish processing it. Okay.